If you've ever leaned down to kiss your dog or cat and suddenly been hit with a wave of really bad breath, you might have laughed it off and thought, well, that's just pet breath. A lot of people do, and honestly, I don't blame you. This idea has been around forever. But here's the truth. Bad breath is usually the very first sign of dental disease. And dental disease is one of the most common and most ignored medical conditions we see in our pets. Hi everyone, I'm Ann, a veterinary technician, and today we're talking about the 11 signs of dental disease in pets, what they look like at home, how they affect your pet's overall health, and why catching them early makes such a huge difference. Make sure to stay till the end because I'll also walk you through the 4 ways how to prevent dental disease. Even if brushing sounds impossible right now, there are realistic options and we'll talk through them. Before we go sign by sign, we need to talk about why dental disease is such a big deal. More than 80% of dogs and 70% of cats have dental disease by age 3. That means this isn't an old pet problem. It starts early, it progresses quietly, and it gets worse over time. Dental disease causes chronic pain, infection, tooth loss, and bone loss in the jaw. But it doesn't stop there. The bacteria in your pet's mouth don't stay in its mouth. They can enter the bloodstream and contribute to problems with the heart, kidneys, and liver. Over time, that chronic inflammation affects your pet's comfort, their behavior, and even their lifespan. And here's the hardest part. Pets are experts at hiding pain. In the wild, showing a weakness meant not surviving. That instinct still exists. So when owners say they're actually acting normal, that doesn't always mean they're pain-free. Let's go through the signs you can watch for at home, starting with the most common. The first sign is bad breath or halitosis. This is the number one sign and the most overlooked. Pet breath should not smell rotten, sour, like garbage, or like metal or blood. Mild odor after meals can happen, but persistent bad breath is not normal. What you're smelling is bacteria. Those bacteria are breaking down food particles, plaque, and inflamed tissue inside the mouth. As plaque builds up, it slips below the gum line where brushing alone can't reach once it hardens into tartar. A lot of owners tell me their breath has always smelled that way, and my response is usually that means dental disease has probably been there for a long time. Bad breath is your earliest warning signs. If you catch it here, you have the best chance of slowing or preventing severe disease. The second sign is visible tartar or plaque. If your pet lets you look at their teeth, check the back molars, especially the upper ones. You may notice yellow, brown, or gray buildup, a thick crust along the gum line, teeth that look dull or rough. Plaque starts soft, but once it hardens into tartar, it cannot be removed with brushing. At that point, it acts like a wedge, forcing bacteria deeper under the gums. Even if only a few teeth look bad, dental disease is usually more widespread. Pets rarely have just one bad tooth, and this is why cosmetic, non-anesthetic cleanings don't fix the problem. They simply can't reach below the gum line where the real disease lives. The third sign is red, swollen, or bleeding gums. Healthy gums should be light pink, firm, smooth around the teeth. Signs of gum disease include bright red or darkened gums, puffy or swollen tissue, bleeding when chewing or brushing, gums pulling away from the teeth. This stage is called gingivitis, and this is the one stage that can be reversible if it's addressed early. But when gingivitis goes untreated, it turns into periodontal disease, which causes permanent damage to the ligaments and bone holding the teeth in place. If you ever see blood in your pet's saliva, on toys, or in the water bowl, that's not something to wait on. The fourth sign is drooling or excessive saliva. Drooling can be normal for some breeds, but changes in drooling are not. Watch for a sudden increase in drool, thick, stringy saliva, blood-tinged drool, wet fur around the mouth or chest. Cats especially will drool when their mouth hurts. Many cat owners never see their cat's teeth, so drooling is often the first clue something is wrong. Excess drooling often means they have oral pain, that there is infection present, that they may have loose teeth, or may have ulcers in their mouth. The fifth sign is difficulty eating or chewing. This is where dental disease starts to quietly affect daily life. Signs include dropping food out of their mouth when they're eating, chewing slowly, chewing on only one side, picking up food and walking away. Some pets will still eat despite pain because eating is survival. That's why they're still eating. Does not rule out dental pain. You may notice your pet suddenly prefers soft food, smaller kibbles, or fewer crunchy treats. These are adaptations, not signs that everything is fine. The sixth sign is changes in appetite or weight. Dental pain can slowly change how much a pet eats. You might notice a decrease in their appetite, your pet skipping meals, them leaving food behind, or gradual weight loss. This often gets mistaken for aging, picky eating, or stress. But dental disease is a very common cause of unexplained weight loss, especially in older pets. Cats in particular are incredibly good at hiding this until significant weight loss. The seventh sign is pawing at the mouth or face. Pets don't point to their teeth, they show discomfort through their behavior. Watch for pawing at the mouth, rubbing the face on furniture, head shaking, avoiding touch around the face. If your pet suddenly doesn't want their face touch, that matters. These behaviors are often dismissed as quirks, but they're common signs of oral pain. The eighth sign is loose, broken, or missing teeth. This is always serious. You may see teeth that move when touched, broken or cracked teeth, teeth missing unexpectedly. A broken tooth can expose the pulp, which is extremely painful and allows bacteria direct access to the bloodstream. Small breeds are especially prone to this due to overcrowding and bone loss. If a tooth is loose, it has already lost its support, and it hurts. The ninth sign is face swelling or abscesses. This is an emergency sign. Watch for swelling under the eye, swelling along the jaw, draining wounds on the face, sudden facial asymmetry. These are often caused by tooth root abscesses. Antibiotics alone are not a fix. These require dental treatment. If you see this, don't wait. The 10th sign is behavioral changes. Chronic pain changes personality. Dental pain can cause irritability, withdrawal, aggression, and less interest in play. Many owners tell me they just aren't themselves anymore. Often dental treatment gives them their personality back. Pain doesn't always look dramatic. Sometimes it looks quiet. And the 11th sign is nasal discharge or sneezing. This is especially common in cats. Signs include chronic nasal discharge, sneezing without respiratory illness, bad breath plus nasal symptoms. Upper canine tooth infections can invade the sinus cavity, causing ongoing nasal issues that don't resolve with typical treatments. Why dental disease is usually worse than it looks? Here's the key thing to understand. Most dental disease happens below the gum line. That's where bone loss occurs, infection spreads, teeth loss, lose support. This is why dental x-rays under anesthesia are so important. They show what you can't see. By the time teeth look bad on the surface, the disease is often advanced. Now, let's talk about prevention, because this is where pet owners actually have power. Dental disease is common, but it's also one of the most preventable conditions we see. The first step to prevention is brushing their teeth, the gold standard. Brushing is the most effective way to prevent dental disease. Use pet-safe toothpaste only. Start slow, focus on the outside surfaces, and reward heavily with treats. Even brushing a few times a week helps. Consistency matters more than perfection. Another preventative is dental chews or diets and products, and look for the products approved by the Veterinary Oral Health Council, the VOHC. These products are proven to reduce plaque, slow the tartar buildup, avoid very hard chews like antlers and bones. They commonly fracture teeth. The third prevention step is professional dental cleanings. Professional cleanings remove tartar above and below the gum line. Usually include dental x-rays if there's issues, and treatment of painful teeth. These cleanings are medical procedures, not cosmetic ones. The final prevention is to start early and stay consistent. The earlier dental care starts, the easier it is. Early habits normalize mouth handling, introduce brushing early, prevent severe disease. Waiting until there's a pain makes everything harder. The final takeaway: if your pet has even one of these signs, it's time for a dental exam. Dental disease is painful, progressive, and it affects the whole body and often goes unnoticed. Your pet relies on you to notice what they can't explain. If this video helped you, please like, subscribe, and share it with another pet owner. Dental disease affects almost every pet at some point, and awareness truly changes lives. If you want more VetTech approved advice to keep your pet healthy and comfortable, you're in the right place. Give your pets a gentle scratch for me, and I'll see you on the next video.